Analyst. This is a domestic draft podcast. I'm Evan Bierman here with Dan Slowick. Today on the show, we're going to be discussing all things football, NFL, fantasy football, and some injury talk heading into the final week of the regular fantasy football season. Dan, I'm excited for this episode today, and I'm excited to hear how your weekend was and what you're drinking.
Yeah, I'm excited as well. I am drinking Delahunt Brewing Company out of San Clemente, California, up over kind of near Orange County. I've never heard of this company. It's actually rather new. So that's kind of maybe the reason I haven't heard of it. They started in 2020, COVID. So they didn't really hit the ground running, not until kind of late 21 till now, where they've kind of opened up a tap room. They're up in Dana Point. They open a tap room in Taqueria up there. So they're mixing beer and tacos. They're also up in San Clemente where they do the facility for brewing, but it's basically Delahunt's the guy's last name. So Todd Delahunt teamed up with a brewer, Kyle Boruff. They started in 2020. They've won a couple of awards as well. So they have a couple of accolades. It's a small brewery. But I thought it was a cool looking can. It's a 1924 blonde ale is what I have. Interesting, when I went to go look it up, it had a couple different names. So the one I found was 1924 Golden Blonde. On the can, it just says blonde, but it's a easy drinking beer, 4.8%. It's got a 3.5 on Untappd. Their description's a crisp blonde ale, subtle haze, brewed with European malts, giving it complex malt flavor. Real easy beer to drink. What about you, man? What are you drinking today?
Nice. So I have Pollyanna Brewing Company. I've talked about them on the show before. Its co-founders, Brian Pawala, who's Pollyanna's head brewer, and Ed Melnar, the vice president of operations. They opened their Lamont location in September of 2014. They've since expanded and now have locations in Roselle and St. Charles as well. What I have here is what Pollyanna is calling a winterized wheat beer. It's a wheat beer with loads of orange juice and vanilla bean added. It's called Dreamsicle Flurries. It's a 3.72 on Untappd, 5.2% ABV. And, it is a pretty good light drinking winter beer. You get a lot of the orange juice in there, but they got a little picture of the Dreamsicle on there, and it does make you think of a Dreamsicle when you're drinking it. But speaking of winter, the weather's getting cold. It's that time of the year. End of the football regular season is coming up, and we have some big injuries, and a good friend coming on here. It's Dr. Nirav Pandya. He is the associate professor of UCSF orthopedic surgery. He's the director of sports medicine at Benioff Childrens, and he's an injury analyst for 95.7 The Game. Doctor, thanks so much for joining us. You have a lot going on there, and it's great to see you could carve out a little time to hang out with us.
No, absolutely. Thanks for having me. I appreciate it.
Yeah, appreciate you having here. We did a little research on you. Saw you played basketball in high school, ran track in college, top 10 record in triple jump at the University of Chicago. Was the dream to be an athlete, or was it always medicine?
It was always medicine. As you can't tell on the Zoom camera, but I'm a 5'6", 120-pound athlete. So that was not my basketball career was going to end pretty quickly. But no, I love running track. As you mentioned, I ran in college. But medicine was always the goal. This is that's kind of how I got into sports medicine. Was love being an athlete growing up, playing sports, and obviously knew about medicine, kind of growing up. My dad was a family physician in the Chicago area. So those two things combined and took me to where I am right now.
Yeah. How difficult is it to be an orthopedic surgeon? That seems like the top of the top as far as, doctors go. How did you land on that, and what did that process look like?
Well, I wouldn't say it's hard. I mean, I think it's, they always joke within medicine, they always joke about orthopedic surgeons being like the dumb ones, like we just like hammer.
Oh, really?
Yeah. But no, the process was, like early on, like if you're interested in sports, or like a couple of different ways you can kind of get into medicine. You could be a primary care physician who kind of does like non-operative kind of stuff. You can be an ER doc who kind of deals with some of this stuff, like kind of more acutely. And then a lot of people go into, kind of orthopedics, and then there's a field called physical medicine and rehab where you can do some stuff as well too. I just loved using my hands. I loved operating. I loved fixing a problem right when I saw it. So I kind of knew early on when I was in college, I was like, look, orthopedics is great. I had some, mentors when I was an undergrad in med school who did ortho, and I loved it, and it's a long road. I mean, you got 4 years undergrad, 4 years med school, 5 years residency, 1 year fellowship, but I love it. I love coming to work every day, and it's the only field where I can like work and talk sports all day. It's like awesome. Everyone wants to talk sports. So it's like, I always say it's like a hot takes every clinic visit with every patient,
And I appreciate you and your profession. I've had 2 ACL surgeries myself, so I've been with y'all in the room, and I appreciate it. So that brings us kind of just some like variety of questions here. Like ACLs, I feel like in the past weren't that popular of an injury. They've become much more mainstream. It seems like everyone, at least in major sports, has a major athlete going down with the ACL injury. I'm curious though, like since it has progressed so far, it's no longer career threatening. It's more or less kind of like, oh, they'll be back next year. Some are much faster as well. What is going on the medicine side to where like athletes are bouncing back and ACL is no longer like, well, they might never be the same, to where like Chris Godwin last night was like running all over the field, bouncing back from ACL.
Yeah, no, absolutely. I think there are two reasons why ACLs have kind of not become this career-ending injury. I think number one is how we do the surgery now. Much smaller incisions, you're able to not damage as much going in. So if you talk to people who had ACL surgery like 20, 30 years ago, they made huge incisions, open up the knee, and just the process of actually doing the surgery just weakened people so much. So I think that's number one, kind of from the surgery standpoint. But I think most importantly is how we rehab these athletes. Like we've really learned how you can push the limits in terms of rehab and getting people back. So the goal now is to get people back or potentially even be better, if they've had some issues before. So I think I'd say 75% of it's the rehab. We know how much you can push people, what they can do, as opposed to in the past where you had an ACL, you were casted for like 3 months, and then you kind of started walking and things like that. So I think we understand the limits you can push in terms of rehab. And now, yeah, I agree. Tear an ACL, they're like, when are you coming back? Not as opposed to, is he ever going to play again?
Yeah. That's my dad's advice when I tore it. I was rehabbing or like right the next day, I think he's like, go ahead, like start like with crutches a little bit, like walking around instead of the full length cast. He's like, you could, I don't know. He's not a sports medicine doctor, but that was his theory, and we went with it.
Yeah.
So does it make you more prone to tearing it again? Because I've never torn my ACL. Dan's torn his twice.
Same one.
So I'm not same one. So is it does it come back stronger, or you just don't know? Everybody's different.
In general, no, that's a great question. It does. They're definitely at a higher risk. So, obviously I tell my patients the best ACL you had is the one you were born with. So, and I think it's no matter how much you rehab and things like that, your risk is still higher. If you're a young person, when you tear it, and you're like under 16, that risk can be 10 to 15%. If adults, it can be 3 to 4%. So I think there's always that risk. But the thing that's hard to kind of figure out is it because there's something inherently wrong with the knee, or the fact that people who tear their ACL are doing stuff that puts them at risk for tearing their ACL. Like most people have done it. They've been skiing, they've been playing basketball, they've been playing soccer. So they get back to doing those things and they're having their knee kind of get subjected to that stuff. So I think it's a little bit of both, but definitely I think that also with that rehab that I talked about before, you're seeing the re-injury rates go down as well too. Because now it's not just getting you back from the injury, but it's like, let's do some stuff to make sure that you don't tear it again. Now, obviously, if someone runs into you, you can't do anything about that, but how you're running, how you're cutting, things like that, they work on that in the later phases of rehab. So you can decrease that risk as well too.
Do you see any other like major injuries going the way of the ACL to where it's no longer career threatening? I know we're seeing a lot of neck injuries lately in the NFL, and it's ending careers. People are retiring early. Or do you see that possibly in the future going the way of maybe an ACL to where it's not?
I think, with neck injuries, I think if we can decrease, a lot of the risk of like what's happening even before they get injured, like kind of using concussions in that same line, like by the time people get to that professional level, they've already had so much trauma to their head or their neck that one injury pushes them over the edge. So I think if you can take these athletes and when they come into the league, they haven't been pounded on since the time they were playing, football at age 8. I think that's where a lot of the kind of the advances we made. I think the other area is with like meniscus and cartilage surgery, like in the past, someone tore their meniscus, they just basically like shaved the whole thing out, and people suddenly would have, you'd have bone on bone, like that's eventually the path you're going. And now we're learning how you can repair meniscus, putting new cartilage in. So I think a lot of those injuries where you heard players kind of come back, but then suddenly you're like, what happened to their career? They were like suddenly really good, and then they kind of fizzled out. I think that's changing a lot because we know how to repair these parts of the body as opposed to just like taking it out and letting people kind of see how they do.
Are there any like really common injuries that you see as an orthopedic, you're a pediatric orthopedic surgeon, I believe too, right? So, I mean, there's anything in general that like a common trend that you're seeing lately that maybe 5-10 years ago wouldn't have been the case?
I think with my population, because I see a lot, obviously I'm doing sports in kids, you'd be amazed how many ACL tears we're seeing in kids. Like when I first started, 10, 11 years ago, a 12-year-old, 11-year-old, a 10-year-old came in and torn their ACL and be like, what's going on? Like every week, you see 10, 11, 12-year-olds who've torn their ACL. And a lot of it's just the way they're playing sports. Like we all, you all were athletes, and we weren't, playing year round X, Y, or Z at age 7, but I get these kids who come in who like at age 5 have declared what sport they're going to do,
right?
Doing 25 hours a week. And suddenly you get this 8-year-old who's got this tremendous skill, but their body can't hold up to it. And then they're tearing their ACL. So I think that's the crazy thing is just my clinic, it's like 14, 15-year-olds and under, and the, ACL, meniscus, second time ACL. I mean, it's crazy. And I think it's kind of the byproduct of, we've gotten good at fixing them and people get back, but then they get back and then they tear again, so I think it's, you have to kind of balance, kind of what we're doing. And are we basically, getting this 10-year-old back to playing sports so they can then tear their ACL again when they're 13 or 14. So it's tough. I think a lot of sports injuries I'm seeing from kids just doing it too much.
That's interesting. Yeah. So it's like the repetitive, your body's not used to other muscles maybe from playing different sports. So it's relying on the same motion. And it doesn't know like how to quick react or anything. Crazy. Yeah, exactly. So even professional athletes, do you think it's kind of are people injury prone, or is it chance?
That's a great question. I think for like the big traumatic injuries, a lot of it is chance. Like you'll get, someone runs into you, you twist this way. I think a lot of that is, a lot of chance. I think some people mechanically, the way they run, the way their ligaments or tissues are set up, they may be more prone to get injured. But if you get to the professional athlete level, you've already kind of overcome that stuff. So I think that people may get one injury and that sets them off a pathway to kind of get more things. But, use example out here in the Bay, Jimmy Garoppolo, like tears his ACL, high ankle sprain, breaks his foot, hurts his thumb, injures his shoulder. Yeah, everyone says he's injury prone, but each of those injuries, like someone ran into him or he like fell down really hard. So I always say people may have bad luck and have a lot of injuries. They're not necessarily injury prone when they get to that level. Yeah.
Love to hear it.
Gotcha. Yeah. So sticking on the topic of football, I don't know how much you dabbled into the concussion protocol, but there's 5 steps to it. And I'm curious, I don't know if you know all the 5 steps, or if you could tell us what those are, that would be fantastic. But how come, it takes some people multiple weeks and other people, they're back 2 days later? I'm curious if, how much you know about that.
Yeah, no, I think, the way we think about concussions, we really have to think about it like a muscle pull or like, any kind of other injury. It's like everyone's brain responds differently to the impact. So just like some people can run full speed and not pull their hamstring, some people will pull it, and how long it takes can vary. In general, what you're looking for in the concussion protocol is that you want to see absence of symptoms. Now, obviously, if someone gets hit and is knocked out in the hospital, it's very clear, but you're looking for headaches, difficulty concentrating, sensitivity to light, things like that. So typically, if an athlete has those symptoms and you're basically waiting for those symptoms to get rid of, go away at rest, and then once that happens, then you're like, okay, we're going to try, the next step is let's try some light activity. So you're trying some stretching, you're trying some light, working out, maybe going a little bit of light weight. If you're able to clear that, then basically each step along the way is then trying to increase intensity level, and you're not have to have those symptoms come back. So some people may like fly through it and suddenly they're like, okay, I'm back doing full football activity and I have no symptoms. Some people may get to like day 3 and you're like, oh, I saw them out on the field. They were doing non-contact practice. But why suddenly now is it 2 weeks later? It's because when they increase that intensity up, their brain's not ready. So it's almost kind of like, we don't think of the brain as sort of something that responds to, exercise or load, but it's responding to the same way. So if you get to that point where you can't exercise or work out without the symptoms coming back, you don't get through each stage. So each stage is really designed to like, okay, let's introduce a new stress to the body, see if you get symptoms. If you can't, if those symptoms are still there, you just stick to that level. So some concussions will look really, really minor. And you're like, why has this person been out for 3 to 4 weeks? And some will be horrible, like Tua's.
Like Tua, yeah.
Yeah. And you're like, wait, they're thinking about having him play, so it's really variable based on how your brain responds. But it is subjective though. A lot of it is subjective and you're basing it on what the athlete's reporting. I mean, you can diagnose concussion, based sometimes on video or what they say, but if an athlete, you're basically depending on this athlete to tell you like day 5, like, oh, I just did full football activity. Do you have any symptoms? Like there is a lot of dependence you're putting on in the athlete as well too, because there's not like a blood test or an MRI that you can get that says, oh, you're cleared, So I think that's the hard thing.
Do you see them figuring out different ways to attack concussions with the NFL moving forward? Not to attack them, but to deal with them or to prevent them? Or, I saw in the preseason they're wearing these big foam things on top of their helmets. What do you think they have planned for the future? Because this is like a huge talking point for the NFL. Everyone knows about it now. Like CTE is out there. Where's this league going? What's the future look like with head injuries?
Yeah, I think that's great. I think if a big thing is obviously getting rid of hitting, and very few teams do any kind of contact practice during the week, so that decreases that risk. I think they're still getting more data about whether these helmets actually decrease concussion. So I think if they have helmets that can particularly wear during practice or potentially get cleared for games, I think that's another thing. But I think it's still the identification, of the concussion is that when you got to take it out of the kind of the hands of the team physicians and have these independent medical evaluators kind of diagnose and keep these players out. An interesting thing, and I think we learned this a lot with Tua, is that even though someone has a concussion, they go in the tent, and if the independent medical person and the team physician disagree, the team physician wins, right? So there's that inherent bias there. It's kind of in page 9 of the concussion protocol. So, the team physician obviously, wants the player to come out. Now they don't want someone to have something horrible happen, but there is a little bit of kind of in between nature over there. So I think now where they're having these, more video reviews where someone independent can pull these players out, I think that's key. But the hard thing is just once you're kind of out of that diagnosis period of time, you do depend on the player. So if they can develop some sort of imaging, some sort of test that can say like, look, this player is ready to go back, I think that's the next wave. Because I think we know when it's there, you take out the bias from the team physician and you're able to protect players. Now it's a matter of, are you getting them back too soon? And that's where we really don't know. There's not good data for that yet.
Right.
Okay. All right. Well, I want to move over to some of this is all fantastic information. I had no idea on any of that stuff. So thank you so much. First, I need to take a break there and
let's talk about the important
information
stuff
we've gotten so far. But let's get
football.
to the fantasy football. No, let's get to some of the big injuries coming into the last week of the fantasy football regular season. The big one I think for me is Lamar Jackson. Injured his knee. It's a sprained PCL, and I know you're going to be able to tell us exactly how long he's going to be out and when he's going to be back, right?
Right. So in general, if you look at PCL injuries in NFL athletes, it's somewhere between 2 to 4 weeks. Zach Wilson, I think, had one earlier, in a prior season. If it's just a sprain, which, I think it's important to understand that a sprain is some degree of tearing, there is some degree of tearing in the ligament, but the PCL, you really don't need it, unless it's totally torn. You can function pretty well with the brace or with rehab. So my gut for Lamar Jackson, barring that there's not any kind of other injury in his knee when they got an MRI, you're probably looking at between 2 to 4 weeks. And then the tough thing though becomes is that he's a mobile quarterback, right? So even if he's back playing, does that impact his ability to be effective? Because he develops his statistics off of moving in the pocket, being mobile. So even though he may be back, what he looks for from a fantasy football perspective may not be good because he's not as effective as the way he is, as opposed to like a pocket passer like Brady.
No, that makes sense. Yeah. I think another big one too would be Kenneth Walker had an ankle strain that they're calling a jammed ankle. And I think a lot of people were saying that's kind of a weird one. You don't really see that too often. And I was wondering, in your opinion, do you know what that means? Did that ring a bell with you?
Yeah, no, it's just funny. Like, I was like, it's a good description. Like when you think about ankle injuries, you think about things kind of twisting, in and out and the ligaments on the outside, but sometimes you can almost like a finger, you can just literally jam the ankle. We call it ankle impingement, where basically, the two bones of the ankle just kind of like ram together. And it's almost like you get a bone bruise or some of the tissue that's kind of gets stuck in there and irritated. Typically for something like that, barring on an MRI that there's not like a very significant injury to the cartilage or the bone, it's really about pain relief. And there are different ways they can get pain relief. They can do injections, you can tape and things like that. So for typically something like that, you're thinking like 10 to 14 days, in general, based on how much pain he has for something like that. So I wouldn't be too worried about that. There are ways they can control, pain, because it's more of a pain generating thing as opposed to like a ligament. Like if the ligament isn't giving you function and stability, it doesn't matter how much pain relief you had. So I would expect probably a couple of weeks for him in terms of statistics to return to normal, but I think, long-term it should be fine.
Okay. One other one that I guess he's back now is Keenan Allen missed, most of this year with a hamstring injury.
Yeah.
My understanding was he tried to come back and then re-injured it potentially, but what did you make of that situation where it took him like 12 weeks to get back on the field from a hamstring injury?
Yeah, hamstrings are tough in NFL players. And we talked about like things that the NFL may be doing to try to, speed recovery. There's a lot of research that they're giving out to different, organizations to look at how can we treat hamstring injuries, because it's so common in NFL players, especially at the speed position. If you look in general for, there's kind of 3 grades of hamstring injuries. There's 1, which is like microscopic tearing, 2, which is partial tearing, which is what most players have. And then grade 3, when things completely tear. So if you look at grade 2 injuries, typically it's about, 20 to 30 days time out. So this may have been for Keenan Allen, like more along the lines of a grade 2.5, 3. The problem is that if it's located a little bit higher up to where the kind of the hamstring attaches to the bone, is a higher rate of re-injury. It can take a lot longer as opposed to like a hamstring injury right in the middle of the muscle. So a lot of it's based on location, how many different hamstrings are involved. I think the problem becomes, particularly with these athletes, is that once they've kind of torn their hamstring to some degree, scar tissue develops there, and then they're more prone to kind of have it get re-injured. So that is one risk factor. I mean, you very rarely will see a wide receiver who just has like one hamstring strain in their career. Like it's something that kind of keeps reoccurring. But I do think that when athletes do take a longer extended period of time, probably means it was a more severe hamstring injury. And they're probably trying not to get that recurrence again. So it happens once, you're out 3 to 4 weeks. If it happens again, then you're at that like 12, 13, 14 week time frame. So they're tough injuries to deal with because there's no surgery for them unless it, completely tears off the bone. So something athletes just have to deal with, and hopefully you're not going to get it. Yeah.
Yeah, I tore mine not that long ago, and it took me like 3 months to get over it. So I can imagine I could not play football after 4 weeks. So some of these, I'm like, that's crazy that you're back out there now. But no, that's fantastic. And then Jimmy Garoppolo, somebody I wanted to talk about too. I thought it was interesting. Yeah, I mean, the 49ers, a quarterback became available today. Baker Mayfield, he's not great, but an option, and they didn't go for him, is my understanding. So that makes me think, is there a chance Jimmy makes it back on the field this year?
Yeah, no, it's a great question. So, like watching the game on Sunday, initially it was an ankle, then they said it's a foot fracture. And then, the Shanahan said in his post, conference, he's out for the season, he's getting surgery. But then obviously yesterday there was reports that they were ruling out what they call as a Lisfranc injury. And, we hear that a lot as like a season-end injury. And the reason why that is a big deal is because sometimes when you get an x-ray, you'll get this x-ray and you'll be like, oof, those bones are broken. And the bones look like they're in a certain way that could suggest that injury is there. And if that's the case, that's kind of season ending. But, usually what athletes will get is they'll get additional testing afterwards. Okay, let's get a CT scan, let's get an MRI. And it sounds like that MRI didn't show, or CT scan, or whatever testing they got didn't show it. So then suddenly you're dealing with just a broken foot, and if those broken bones are small, it's not that bad, and they're stable, meaning they're not going to move out of place, there's a possibility that someone could be back to play in 6 to 7 weeks without surgery. And that seemed kind of be the buzz over in the Bay today, was that Jimmy could be back if they're in the second or third round of the playoffs. So I think there's a good possibility, since he's not getting surgery, he could be back. He's not a super mobile quarterback, so he doesn't necessarily need to have, a very strong foot. And now it's going to be this weird situation where it's like, could Jimmy Garoppolo be back in the playoffs? There's kind of buzz. Could Trey Lance be back? And then Brock Purdy win a bunch of games? And then we've suddenly got 3 quarterbacks that we're trying to figure out who's going to play in the playoffs. So I think there is a decent possibility, based on what was reported today, that Jimmy will be back.
That's some serious 49ers optimism. I love it.
Yeah. Yeah. So we'll see. But it definitely changed a lot in the past 24 hours, from end of season, never going to see him take another snap, to Jimmy can lead him to the Super Bowl and come back in the playoffs. So we'll see.
It's gotta be exciting talking about playoffs. Let's talk about a team that's not going there. The Bears, our quarterback, the buzz this whole last week was, should we play him? Should we not? Cause he had that shoulder injury. Any insight on that injury? Do you think it's non-throwing shoulder? I know there was some ligament damage. I believe he even said he tore some in there. Yeah. Do you believe, would he have to have surgery in the off season? What kind of effect is it having on his playing? Cause he threw 2 picks. Is that a part of his shoulder? I don't know what's going on with Justin Fields.
Yeah. So I think you definitely saw that. I think it was a play where he kind of got impacted in his shoulder. And one of the things you worry about is, that AC joint, or your shoulder separation. And what that is basically ligaments are getting torn. The only way that those joints can kind of get, disrupted is if a ligament tears. But it really is in a non-throwing shoulder. It's about pain relief, right? So they a lot of times what they'll do is they'll do injections, they'll do things to kind of get people back on the field. And for a non-throwing shoulder, I think it's totally reasonable. Most people who have these injuries, whether it be even a regular person or a pro athlete, don't need surgery on this, unless there's some other injury that occurred on top of this. And it's hard. I mean, when your team is not necessarily performing well, do you want to risk your franchise quarterback? And I call Justin Fields the best Bears quarterback since Sid Luckman, in Chicago.
True. Yeah.
What's the risk? Why are you out here? And also, something like he has hamstring tightness and things like that. So it can impact his ability to how he falls, after play, or how he basically is, kind of, even throwing motion can be affected because your other shoulder's obviously involved. But I think this should heal up no problem, and he shouldn't have any, need any surgery. The question is, you just don't want him to be continuously banged up and then develop something else as a result of trying to play through it.
So do you buy in the meatball take that, when you play not to get hurt, you get hurt?
I do believe that. And I tell my athletes, when they're going back, like the worst thing you can do is try to play cautiously because you're going to get hurt. You got to go all in because that's how your muscles are going to be firing. You're going to be doing normal stuff. When people get cautious, that's when they get hurt. So I totally agree. Like you're either all in or all out. And if you're trying to like, I'm not going to try to fall on my left shoulder, like, yeah, then something's going to happen.
Yeah.
Wow. Interesting. Taking it over to our Bulls, keeping it on the Chicago sports topic. Lonzo Ball has this knee injury that everybody in Chicago has been like, it's been the buzz over here for the past year.
Depressing.
I think, and it was initially diagnosed as a small meniscus tear in his left knee. So everyone's thinking, he'll be back pretty soon, and he's
nerve
still
damage.
Out. So
other things being
What
whispered.
do you know about this injury?
Yeah, no, kind of been following that along, so like, people get a meniscus tear, small meniscus tear. And, I know they had reported that he also had a bone bruise as well too. So, when you hear like, oh, small meniscus tear, you're like, okay, that's probably not what's causing the pain, but bone bruises can last a while, particularly when they're in an area that's, high stress areas. You have a bone bruise where you kind of get hit and you're not constantly loading that area where you're running, not a big deal. It gets better. But if you're constantly loading that. So I think a lot of the thought was like, it's just taking time for the bone bruise to get better. And then obviously you hear reports. I think his dad said that it was nerve damage or some sort of nerve irritation, which makes sense when you kind of think about why someone would continue to have pain after a small meniscus surgery. Now, obviously we don't know like what exactly was going on with the nerve, but in general, if it was just like a regular kind of base straightforward meniscus surgery, sometimes there can be scar tissue or something that develops around the nerve that causes you to have a lot of pain. And then just because you get rid of whatever is irritating that nerve, it can still take 3 to 6 months for that nerve to recover. So one of the examples I use when people who type a lot get carpal tunnel, they get surgery for it. And then they're like, I had surgery, but I still have numbness, tingling, and it still hurts. I'm like, well, it takes a while for that nerve to kind of like get better, and kind of heal up. So that sounds like what's going on with him right now. Obviously, if they'd done like a repair where they're sewing meniscus together and things like that, that can be a much more difficult process. But it sounds like, assuming that that's what they identified as a problem, that he should be back. The problem is that if he's having pain still, then you can't be effective, and then he's going to injure something else. So assuming that's what they did, I wouldn't be surprised if come like January, February, which would be kind of like right around the 3-4 month time frame at which he had his surgery, he could be back. But he just hasn't played in a long time as well too. So that's the other thing you're worried about. But I definitely, my friends in Chicago are definitely very, very frustrated with the Lonzo Ball situation.
Yeah.
Absolutely.
So are we. Last kind of question, and then we'll get you out of here. This is nothing to do with Chicago, but I am, and I know you are a basketball fan following the NBA. The number one overall pick, Chet, was out for the year, hurt his foot, and a player of that stature, a 7-footer. Do you see that kind of as a huge red flag? And is he going to be? I mean, same with Zion Williamson. He was a larger person as well, and he had the foot injury. He was out for a long, long time before he started playing. You kind of going that same route with Chet, extremely cautious.
Yeah, I would be. Yeah. I think in the issue with Chet, I mean, everyone's kind of concentrating on like, he's a little bit skinnier. He doesn't have muscle mass. I think the larger issue with these big players is that you're getting big individuals trying to do things that like they're 6'1" or 6'2". And just because they can train that way, I think bodies begin to break down because of that. Zion is playing it, like he's John Morant, and his body is telling him he can't handle that. And with Chet Holmgren, the way he cuts and pivots and moves, he's almost like a point guard. And then you're worried about his foot. You're worried about then also the fact with him is that he's trying to do all that stuff and then getting physically pounded all the time as well too. So I do worry about, what does that mean for him long-term? And is it going to be, particularly with foot issues with big men? I mean, Yao Ming had it, Zion's had it, Durant had it when he was kind of in the league. He's having it. So it's hard. It's just hard to the feet take a lot of stress at this level. And it may be just something that cumulatively adds up for him over time, but he's a great talent. But I do worry that his first couple of games, he's already got a serious foot injury, and hopefully he doesn't have then this kind of plethora of other issues that develop because of it.
Well, Doctor, thank you so much for giving us some time tonight and spending your minutes with us. If people want to find him, follow him on Twitter. He's at Dr. Nirav Pandya. That's DrNiravPandya. I know if you're looking for any insight on like sports injuries, if your fantasy player is going to play, how long they're going to be out, give him a follow his advice. This is Dr. Nirav Pandya. Thanks so much for being here with us tonight.
No, absolutely. Thanks a lot for having me. I really appreciate it.
Thanks, man. All right. Thanks again to our guest, Dr. Nirav Pandya. He is again at Dr. Nirav Pandya on Twitter. He's the associate professor of UCF orthopedic surgery. He's director of sports med at Benioff Childrens and the injury analyst for 95.7 The Game out in San Francisco. All right, Dan, our Cubs made we call it a big move, but they made a move today, and the stove is hot in the MLB.
So
What do you
hot.
think about the Cubs signing Cody Bellinger?
I mean, I'm down for any and all moves. After
Mhm.
kind of not doing much last year, I'm down for us to stir the pot. A lot of new faces, a lot of new names. Bellinger, I mean, former MVP kind of caliber player, has been really, really bad the last like 2-3 years. Can't really hit. But I mean, at his lowest, right, he's still a Gold Glover. He can play center field, can play first base. At his highest, he's MVP. So I like it. The checkbook's open. I like them making moves. I know we're looking to sign some shortstops. I've seen Xander Bogaerts, Correa, Dansby Swanson all out there. So it's fun. The winter meetings are happening out here in San Diego as well. So it kind of feels cool to be close to the action. Aaron Judge seems like he's about to sign to the Giants. I don't know. I love offseason winter meetings baseball. It's a lot of fun. What about you? What do you think?
Cody Bellinger, I mean, it's a 1-year deal,
Yeah.
17.5 million, I think. So prove it deal. And like you said, he's got a pretty decent floor, I guess, as a defender
Right.
and really high upside there. I mean, if he gets back to his playing ways, but we'll see. It's a 1-year deal. But I do like to see the Cubs making some moves. They're opening up
Right.
the checkbook. It seems like they're open for business now. They said they're open to potentially signing 2 of these big name shortstops out of those 3 that you mentioned.
See it happen.
So yeah, it's good to hear it that they're in on some people and throwing some offers out there. I think Jed said he's close to some deals, but we'll see within the next couple of days if they get anything else done. It's just good to be talking about baseball again after how bad last season was.
Yeah. All right. It's important time right now in fantasy football. Teams' seasons are on the line this week. Some of us are going to win in advance or lose, and we're done. Waiver wires has never been more important than right now. Give me your most important waiver wire Wednesday of the season.
Most important waiver wire Wednesday. I'll see what I can do. It's kind of a rough week for waivers, but there are some names out there. The doc just said Lamar Jackson could be out 2 to 4 weeks. Tyler Huntley is his backup and had some great weeks last year. He can find Mark Andrews. He can run himself. He had a rushing touchdown this last week in relief of Jackson, put up 15 points after Jackson went out. So if you need a quarterback, he's got a good schedule down the stretch too. I like Tyler Huntley until Lamar Jackson comes back. Zonovan Knight would probably be my top running back pickup from the Jets. He got most of the work this week. James Robinson was active, only got a couple carries. Ty Johnson does not look to be any threat to Zonovan's playing time. And we'll see if Michael Carter comes back next week. But he looks like a good NFL running back, and he's got a good schedule the rest of the way. James Cook's probably the other big name if you need a running back. He's 25% owned. He got more work than Devin Singletary did this last week, and he's on probably one of the best offenses in the league. Cam Akers, I don't really want to talk about Cam Akers too much because I don't think he's, worthwhile. But he's a bench stash, I think. See if he does it again. He had a nice week this last week. We'll see if he can do it 2 weeks in a row. The Rams, I think, just one of the worst offenses in the NFL right
They
now.
got Baker coming to the rescue.
Yeah, and they just picked up Baker Mayfield, so I think that's a bad sign. But if you need a running back, I think he might get more work than some of the other guys you're going to find on the wire. But at this time of year, especially if you have a playoff spot locked up, you got to grab guys like Samaje Perine if he's back out there after playing this week. People thinking Mixon coming back next week, maybe. Dontrell Hilliard is the backup to Derrick Henry, Jalen Warren. Alexander Madison's like the premier backup to have on your bench. And then Khalil Herbert of our Bears might be coming back next week or the week after. So some playoff pickups, guys to have on your bench. I mean, now's the time to pick up those handcuffs. Wide receivers, Jamison Williams had his season debut. He was the 12th overall pick in the NFL draft. So he's supposedly a stud. We'll see how he comes back and rounds into form, but he only got a few snaps. I think he could be good down the stretch. Zay Jones, up until last week, was looking all right. So if you need somebody that's going to get some playing time and get some targets, Zay Jones is a good grab. Michael Gallup is 54% owned. He had a nice last week, and I might throw Kadarius Toney back on this list. Somebody to keep on your bench and just keep an eye on. See if he gets back in that lineup. He looks good when he's actually on the field. So just a bench stash. Definitely do not throw Kadarius Toney in your lineup when it's the most important game of the regular fantasy season.
Yeah.
Tight end, though, Greg Dulcich is probably the top guy to grab if he's out there in your leagues. Cortland Sutton just got injured. He had a hamstring injury, so he might be out a couple weeks. And Dulcich looks like Russell Wilson's go-to guy. Not that you really want anyone from the Broncos at this point, but he would be the one to grab. And then if you need a defense, Kansas City has a great stretch run of matchups here. I think play Houston and Jacksonville. Maybe, I mean, there's a couple bad teams in there they're going to be facing right in a row. So Kansas City is who I'd look to grab. They're probably out there on the wire. So those are your pickups for this week.
There it is.
Yeah, last week of the fantasy regular season. I know a lot of my leagues are really, really close. Within 1-2 games. I know you yourself, you're playing for a
must-win scenario. Yeah.
Yep. So
Feels
there
good.
you go. Those are your pickups, Dan. All right. Why don't you give us your picks for week 14? And we'll get everyone's.
We're running pretty high here lately. I mean, I've had some good weeks in a row. I think 12-14 2 weeks ago, 9-5-1. How about a tie? Throw that in the garbage. But I mean, we're above 500. We're doing well here. So who do we got here in week 14?
I think it's going to be your first undefeated week here.
Yeah.
Thursday night, you got Vegas at the Rams.
Vegas. Raiders.
Jets at Buffalo on Sunday.
Bills.
Cleveland at Cincinnati.
Bengals.
Texans at Cowboys.
Cowboys.
Vikings at Lions.
I thought I saw the line that the Lions might be the favorite here, but I think the Vikings are going to kill them.
Yeah, the Lions, I think, are the betting favorite right now. They've been putting up a lot of points. Philadelphia at New York. Giants.
G-Men.
Baltimore at Pittsburgh.
Steelers.
Jaguars at Titans.
Titans.
Kansas City at Denver.
Chiefs.
Carolina at Seattle.
Seahawks.
Tampa Bay at San Francisco. Brock Purdy.
Buccaneers.
Miami at Chargers.
Fins up.
And then Monday is going to be New England at Arizona.
My Arizona Cardinals.
There you go.
There it is.
Undefeated week. It's going to be the first one of the season.
Heard it here first.
Lock in your pick. Heard it here first. Lock in your picks. All right. Dan,
I do have a fact.
I do have one. Yeah.
What is it?
And it's an injury fast fact. You know, I was sticking on the injury topic. So the question is, what 4 school sports cause the most injuries?
School sports that cause the most injuries? Football.
Okay.
Soccer.
Okay.
Volleyball.
2 for 2. Volleyball's 3 for 3.
And then is lacrosse on there or something?
No, it's actually basketball is the 4th one. I'm surprised you got volleyball. That's yeah. I wouldn't have guessed. That was definitely a distant 4 is volleyball. But football number 1, 455,000 injuries a year. Soccer 412. So those 2 far. And then basketball 169,000 and volleyball about 59,000. So those are your top 4 school sport causes most injury. There you go.
Ouch.
Yeah. Thanks again to our guest, Dr. Nirav Pandya, for joining us today. For Dan Sloak, I'm Evan Bierman. You've been listening to the Domestic Draft Podcast. If you're listening on Spotify, don't forget to rate the show. You can find us on Twitter at Domestic Draft, on Instagram at Domestic Draft Podcast. Our website is domesticdraft.com, and you can watch the show on YouTube. Just search up Domestic Draft and drop us a sub. Thanks again for listening.
Cheers.